Good morning, good afternoon, and good evening. Hey guys, my name is Omer, and I'm a doctor. My aim is to bring you knowledge which can improve and sometimes even save lives. There are many celebrities and famous people that you may know who have suffered from a heart attack. Some of them are Rosie O'Donnell, the TV personality, singers David Bowie and the late Elvis Presley, Larry King, the TV host, and Kelsey Grammar, most notably known for his work in the American TV sitcom Fraser. Celebrities inspire us in many different ways, and knowing that some have had a heart attack and overcame it is even more inspiring. You can do the same. In this video, I will tell you all you need to know about a heart attack, how to recognize it, and what to do in that situation. This video links very closely to my previous video about angina, so please see that first to get a better understanding. In that video we talked about the coronary arteries and how atherosclerotic disease in those arteries causes a narrowing, which in turn causes angina. Now let's talk about heart attacks. In most cases, angina occurs first, which then progresses into a heart attack. This is because one or more of the coronary arteries or its corresponding branches suddenly become completely blocked. This means that blood can't get to that specific part of the heart muscle, and so it's starved of oxygen and nutrients, and hence this causes damage. If this is not treated very quickly, then that area begins to die. This is called myocardial infarction, also known as a heart attack. If one or more of the coronary arteries is blocked, then a large part of the heart muscle is damaged because little or no blood reaches that area. Equally, if a small branch of the coronary artery is blocked, then only a small area of the heart muscle is damaged. If a part of the heart muscle dies, then that area will eventually be replaced with scar tissue, and this can cause many complications, which I will mention later on in the video. Sometimes, a massive heart attack can cause sudden death. During a heart attack, you might experience some of the following symptoms. Most commonly, you may experience pain or discomfort in the chest. Patients usually describe this as a tight band around the chest or heaviness which feels as if an elephant is standing on the chest. However, some people experience only mild chest pain, which they mistake for heartburn, indigestion, or a pulled muscle. Rarely, some people can experience a silent or atypical heart attack in which they don't experience any pain, and this usually affects the elderly diabetic population. If you do experience chest pain or discomfort, it can commonly spread to the neck, jaw, or arms. Either one of the two arms can be affected, however more commonly the left arm is affected. You may also experience shortness of breath, nausea, and palpitations, which means you become aware of your heart beating strongly or irregularly. You may also become sweaty or clammy. Angina symptoms and symptoms of a heart attack can be very similar. However, during a heart attack, the pain does not resolve with the medication you would normally use for angina and is usually more severe and lasts longer. This is a time-critical condition, so if you think you or someone around you is having a heart attack, then call for an ambulance immediately. In my previous video about angina, I have already talked about the causes and risk factors of cardiovascular and atherosclerotic disease and the way to prevent or minimize them, so please refer to that video. However, briefly, the risk factors are smoking, high blood pressure, being overweight, high cholesterol, inactivity or sedentary lifestyle, a poor diet, uncontrolled diabetes, family history, and ethnicity. Doctors sometimes use the term ACS, which stands for acute coronary syndrome, and it encompasses 3 emergency conditions of the heart that are caused by blockage of the coronary arteries. These are unstable angina and 2 different types of heart attacks. The first type of heart attack is picked up from the initial ECG and is called a STEMI, which stands for ST elevation myocardial infarction. The other type of heart attack requires further ECGs or blood tests to diagnose, and this is called a NSTEMI, which stands for non-ST elevation myocardial infarction. A STEMI is usually always a more serious type of heart attack that requires immediate intervention. Apart from doing ECGs or EKGs, a special blood test is done to measure the troponin levels. Troponin is a chemical that is released over time when the heart muscle is damaged or is dying. This test is very sensitive to the heart muscle, so if it is raised, then most of the times this means that you have had a heart attack. However, there are some other reasons this may be raised, but your doctor will have a good idea what has caused the troponin to rise based on their clinical assessment. An angiogram may be performed. This is the gold standard investigation to assess the level of atherosclerotic disease in the coronary arteries. If you are having a STEMI or a massive heart attack, then you may be taken directly to the cath lab, where doctors will do your angiogram to look at the coronary arteries and will be able to tell where the blockage is. At the same time, the doctors will be able to unblock the affected artery or arteries by doing an angioplasty alongside the angiogram. Angioplasty essentially means inserting a stent to unblock the affected artery. However, if 3 or more arteries are blocked or affected, then a coronary artery bypass may be necessary. An echocardiogram, which is a jelly scan of the heart, may be done to look at how the function of the heart has been affected as a result of the heart attack. Other tests that may be considered include CT or MRI scan of the heart and myocardial perfusion scan. So what do you do if you think you're having a heart attack? 300 milligrams of aspirin should be taken as soon as possible if a heart attack is suspected. If you have this available and you have been advised by your doctor that it is okay for you to take normally, then you should take it. Don't worry if you don't have it, because the ambulance crew will give you this, so let them know if you've already taken it beforehand. The paramedics will also consider giving you oxygen, intravenous pain relief, and an anti-sickness drug if needed. They will also consider using a nitrate medication which aims to temporarily widen the coronary arteries and hence improve the blood supply to the heart. The coronary arteries can be unblocked by angioplasty as discussed earlier, or very occasionally by the use of clot-busting drugs known as thrombolytics. After the initial treatment, you will be strongly advised to take certain medication following a heart attack, which will help reduce the chances of a further heart attack in the future and help to prevent heart disease from getting worse. These include antiplatelet drugs such as aspirin, which help to prevent blood clots and reduce chances of a further heart attack. A beta blocker medication can also be used to slow your heart rate, and an ACE inhibitor to lower your blood pressure. Both of these help to protect the heart. A statin medication is used to lower your cholesterol levels, which slows down and reduces the formation of atheroma in your blood vessels. There are many complications as a result of a heart attack, and these usually depend on the amount of heart muscle damaged and the area of the heart affected. Some of the complications include arrhythmias or abnormal heart rhythms, heart failure, and heart valve problems. There will be a specialist cardiac nurse involved in your rehabilitation after a heart attack, and you will be followed up by a cardiologist. Please remember, guys, that this is a time-critical condition. The sooner a heart attack is treated, the more likely the damage will be reversed and the complications will be minimized. That's it for today's video, guys. If you have enjoyed it and found it valuable, then please consider subscribing and hitting the notification icon so you don't miss out on my future videos. Also, like and share the video with your family and friends so that they are aware of the symptoms and signs to look out for to identify a heart attack either in themselves or in someone that they may know. You may help save a life by passing them this information. In my next video, I will tell you the story of an unbelievable patient who had a heart attack because of using recreational drugs. I am a full-time doctor, and my aim is to provide you with knowledge which can improve and sometimes even save lives. If you have any suggestions for future videos, then please leave a comment below. All the best, guys. Look after yourselves, stay healthy, and remember, knowledge saves lives.